Good afternoon. Today we are going to present our reading report. The members of the working team are Lisa Fernanda Centeno, Sharon Sofía Leguizamo, Leslie Natalia Rincón, María José Narváez, Verónica Moreno, and Juan Felipe Naranjo. The article to be presented is Recent Advantages in Development on Invasive Ventilator Release. The journal consulted is Transient Anesthesia and Critical Care, and the topic is Winning and Release for Invasive Mechanical Ventilation in the Critical 3. The program is Cardiopulmonar Intervention Strategies 3.
Objective: to analyze and compile recent research on the process of weaning from invasive mechanical ventilator in the intensive care unit to determine the most effective strategy for this practice. The review focused on criteria for screening performing the spontaneous breathing. In trial and making extubation decision, essentiality is seeks to the identifying high risks factors for failure and proposes clinical strategies that can improve the success mortality associated with lack of for failed weaning.
Biography. He lived ophthalmologist at the Central Hospital of Dazhou located in South Province, China, which a focus of improving multidisciplinary medical care. She has participated in clinical studies and scientific reviews on the inpatient treatment of critical patients and invasive procedures.
Relationship with the subject matter of consultation. Its main contribution is to review the best strategies for unifying extubation, seeking to improve the current low success rate. It also highlights the cardiopulmonary relationships, indicating that cardiac dysfunction and fluid balance are key causes of failure and validated deaths. Use of non-invasive support as an essential post-extubation intervention.
The synthesis of the document: mechanical ventilation is an important tool used to manage and control acute respiratory failure. Thanks to different scientific advantages, it can be used in two forms: invasive and non-invasive. This article addresses different concepts used to mechanical ventilation to understand how to appropriately train patients with respiratory failure. It uses evidence and results from different databases to support its findings. It also examines articles and other studies related to the process of weaning from invasive mechanical ventilation, extubation, spontaneous breathing trials, risk factors, abnormalities, and other topics to determine the correct research to consider when treating this type of patient. A study called Wine Safe was conducted, which was key to evaluating how patients respond to extubation after the spontaneous breathing and weaning test. In some cases, improvement was observed in patients with respiratory failure, and in other cases, invasive mechanical ventilation research had to be re-evaluated as the results reported in various databases did not fill the expected results. This finding highlight the need to continue monitoring this weaning and extubation process continuously so that healthcare professionals decided regard this type of.
The articles helped me understand the importance of having a plan, progressive evidence-based weaning process based of clinical criteria, because early results from mechanical ventilation improves rapid recovery, reduces mortality, and optimizes the site in the intensive care unit. New research highlights new breathing strategies such as spontaneous breathing to avoid air faulty and reintubation. Waiting 48 hours therapy promotion pains will begin. Considering the complexity of the process of weaning from the invasive mechanical ventilation, focusing on the levels of evidence and managing the appropriate protocols. It also provides in the with new insight into how do the treat early rehabilitation and strengthening mechanic muscle. Working for weaning and patient progress in the also giving me insight into advice and technology, such as diaphragmatic monitoring, ultrasonic, and high-flow nasal cannula. I read it is the art to my roles as physical therapist because we are responsible for the early functional and respiratory rehabilitation of patients, contributing to the improves their independence and quality of life.
Xiaoji Liu Physician in the critical care unit and Dachau Central Hospital located in China. She is the principal investigator of the study and has written numerous texts of the intense care medicine and mechanical ventilation. Her focus is on ventilator winning strategy and the comprehensive management of critical patients.
Writing with SOF 2023 classified tips or waiting according to their duration and accountment of the process. Type is note attempt nude, short in 1 day or less, medium union 1 to 7 days, late in more than 7 days, when new failure depending on the death at night, the says. Current sheet dation 35% failed twin at 19 days. Hospital mortality 38.
Recent advances in invasive ventilator unit aim to gradually improve ventilation support to improve prognosis and reduce complications. The main goals are to restore spontaneous breathing, reduce the risk of complication, and determine the safe time for intubation.